I did it again. Signed in with the wrong one.
You're fine. I just goofed up something. Good. Doing.
So have you figured out how all this is going to work, Danielle?
We're all going to learn together. No, I think I got it.
How many breakouts will you have?
16.
Wow.
I think that the easiest way, honestly, is going to be opening the rooms and then people can choose wherever they'd like to go.
Yeah.
I just don't know what the flow will look like for everyone.
You could try to set it at capacity if you wanted. But that's hard to do if you don't know exactly how many are going to attend.
Right.
How many are pre-registered?
Probably like 50, 45. I'm trying to count you guys in that. So plus all of you will be like 60 something.
So did you just want me to go to the NAMI room with you?
Yeah.
Okay.
So you might be the only one there for a moment because
Because you have to check on everybody.
yeah, I'm gonna have to try to figure this one out.
Yeah, I've only done this when you've been assigned to a room.
Right. Those of you that were here at the speed dating one, I won't cut you off this time when you're talking. That was just fun for me the first time. And that's what speed dating's about, right? Cutting people
Didn't
off.
mind at all, Danielle.
Thank you all for coming. Sorry, I deleted all the rooms on accident, so I'm going back through.
Hi, Danielle. Sorry.
Like, where is she?
My computer is being weird, so I'm using my cell phone.
That's all right.
And my computer, for some reason, is not wanting to log in. So I'm like, okay.
So on your cell phone, can you see a place that asks for breakout rooms?
I can't right now. Mm-mm.
I can't see anything on mine.
How about now? Like at the bottom of your screen.
Yep, I can see it now.
I can see
You
it,
can
Danielle.
you can choose wherever you go.
Yep.
Okay.
Yep.
I'm gonna close them for right now and open them back up after we go through our introductions.
And where are our chat rooms, Danielle?
What do you mean?
Where will we find them on our screen? I'm not seeing it.
I just took them away again.
Oh, okay.
So when I'm gonna make them open after everyone goes through and does their
Okay.
3-minute thing. Anybody have an interest in going in a certain order? All right.
Well, what did I miss?
Oh, no, nothing. Just I was recreating the breakout rooms. So everyone's just gonna get the opportunity to do a brief overview of their organization. And then after that, I'm gonna open up rooms. And I think I'm just gonna let participants choose where they go. And honestly, if you guys have more than one person in your room, you can, I mean, if you wanna go around and pop in on other organizations and hear what they're talking about too. I'm giving everyone the power. So we'll see how it goes.
Did we get a lot of people that registered?
Yeah, I would say like not including the presenters. There's like 45-ish.
Wow, that's good. That's really good.
So are you the Rosecrans girl, Joan?
Well, myself and Danita Lind is joining me. She's our administrator from our Rosecrans Griffin Williamson Substance Abuse Services. So I thought maybe there'd be some questions about kiddos and that kind of piece too. I hear a baby.
Sorry, that's my daughter. She's in her gated community is what we call it. The living room, AKA.
So I apologize if this has been asked already, but so like if people want more information or they want us to send them things, should we just gather like their email addresses, or will there be something like some bigger list, or how were you thinking that would work?
I definitely will have the people that have signed up and attended a list of them, but if you want to take them while you're talking to them more one-on-one, that's
Okay.
totally fine.
Okay.
Just curious, does anyone have a Danielle Turner that's helping in their room or with their presentation? I don't remember seeing that name, so probably just a participant, but I wanted to make sure. Javier, is Anne helping you out if you're here?
I am here. No, it's just me tonight.
Okay. Don't you wish that Zoom had like waiting room music?
You could choose one.
Suppose I could.
Yeah, I can turn on my Spotify, kind of do like some classic rock jams or something. That's pretty much all I got.
Sure, go ahead, Lori.
I'm a little afraid some of the songs will come up will be inappropriate.
I'll blame you. It's fine.
This one's actually really appropriate.
Did everyone have a good Monday?
How about you? Do you have a good Monday?
Yeah, it was fine. You know,
Super busy.
working from home with my dog helps. He has a skinned nose and it's making me very sad though.
Aw, poor puppy.
Stephanie left for a second, but she's going to be back. She said her Zoom is not working properly. Are you guys good with me having the open approach to people just picking where they want to go and kind of going around the network? Or would you rather me assign?
I think them picking is kind of cool.
You too. As long as someone picks your group, otherwise you're gonna sit there going, oh, nobody wants to listen to me.
As is the health fair booth life, I feel like though. You try to draw people in, like come on over to me. Stare them down.
Candy.
Yeah.
Candy on the table.
Yeah.
There's Danita checking in now, so it's good.
All right, I'm gonna give it a minute and then I'm gonna let the participants in. But Mary, you're good covering NAMI for a few.
Sure. You'll find me.
I'm gonna mute all of you, and then when I choose you to speak,
She will be heard
good luck.
in your video now. Okay, thanks.
Hi guys. I'm gonna give it a minute and let people sign in. Hope everyone's having a good start to their week. I'm just going to get started with introducing myself. For those of you who don't know me, I'm Danielle Angelari, and I'm the Executive Director of NAMI Northern Illinois, and we are the National Alliance on Mental Illness. We serve Winnebago and Boone County, and you know, NAMI for short. I think you've heard of us possibly before. So what do? We, truly listen to our community. We offer many support groups for individuals living with mental illness and their families. We educate our families, we educate the community through various sessions. We advocate to shape public policy and programming for people living with mental illness. We lead many awareness events, actively fight stigma, encourage understanding, and really keep mental health in the forefront for everyone to improve response to mental illness for all. So we started in the mid 1980s in our community, and we really started grassroots, just like the national organization. And so what, we've been here how many years, Mary? Pushing 40. Sorry, hold on. I'm unmuting you. There it is.
Well over 30, almost 40.
I still didn't hear you.
Well over 30, almost
There it
40.
is. There it is. Okay, sorry. So I really just wanted to wish you all a happy mental health month, and I appreciate all the organizations here today to give our community more information and each other. So I know no one requested to go first. So I'm just gonna go around my room and choose organizations, if that's fine. You all have 3 minutes, and like I was saying before, if you were here for our social services speed dating event, I will not cut you off this time, so I'll be lenient with 3 minutes. Xavier, would you like to go first?
Sure, great timing because everybody's walking in behind me, so hopefully you can't hear the back noise, but I will go ahead and start. Good evening, my name is Xavier Whitford, for those of you that don't know me, and I'm the founder and executive director for the Tommy Corral Memorial Foundation, or TCMF is what we call it for short, and Each Breath of Faith Ministries. The Tommy Corral Memorial Foundation is a 501c3 nonprofit organization that's locally established and been established for over 6 years in honor of my 19-year-old son, Tommy, who lost his battle to depression to suicide in August of 2014. Over the last 6 years, TCMF has been working in the community to increase education on the factors that lead to suicide, actively developing resource connections, and providing financial support to help those struggling with mental illness and suicidal thoughts. We have an amazing board of 8 individuals throughout our community from a variety of ages and backgrounds who are committed to providing quality support and education to those living with mental illness or who have been affected by suicide loss. TCMF has provided valuable mental health first aid training to the community members and organizations to help educate our community to assist someone experiencing a mental health or substance use crisis. To date, we have trained over 350 individuals, and we have several trainings lined up throughout the next several months, thanks to COVID, that we had to cancel a lot. So we're rescheduling many of those this year. We have provided hundreds of hours of free counseling to several dozen individuals who have needed the critical therapy but did not have the financial means to do so. We do this by establishing relationships with over 8 different local counseling groups, and these relationships allow us to make quick referrals for assessments and set up quick ongoing therapy sessions for individuals who need it. TCMF has either collaborated with or has provided thousands of hours of support groups for teens, young adults living with mental health issues, individuals living with eating disorders, grieving mothers, and suicide survivors. We also provided a variety of educational presentations at churches, schools, organizations, reaching thousands of individuals each year, both in our community and also nationally and internationally. We actively advocate and work with local, state, and federal leaders to improve and create new legislation to improve services and support for individuals living with mental illness. And our foundation is solely funded by individual donations and community partners. We host 3 major fundraiser events a year. In April, we do our Each Breath of Faith 5K, 3K, which is a family-friendly and dog-friendly event that brings over 20 different mental health resources into one area for individuals to learn about. In August, we have our Ride to Fight Suicide, which brings in hundreds of motorcycles and trucks and hot rods to the ride, which while bringing awareness to our greatly affected community by suicide and talking about suicide prevention. In October, we have our Fight for Life softball tournament, which brings in over 24 different teams from all over the United States and spreads awareness about mental illness and suicide prevention. Our foundation is truly committed to our community, and our mission has always been to seek to expand the understanding, empathy, and provider services in our community for mental illness and suicide. So to achieve those goals, we always pledge to support local organizations, families of suicide, and those affected by mental illness, however possible, and while working to improve education concerning these topics in our schools and throughout our community. So if you're interested in learning more about us, you can find us on our website, which is simply www.tommycarellmemorialfoundation.com, or follow us on Facebook, Instagram, or Twitter at TCMF21. Thank you, Nami and Danielle, for the opportunity to share about our organization tonight. I appreciate it.
Thank you very much. How about Swedish American Center for Mental Health?
Hi, my name is Katie Missler. I am the director for the Center for Mental Health at Swedish American. We are located on State Street in Rockford, and currently our program, we have inpatient and outpatient programs. We have a 20-bed adult inpatient mental health unit, and we have a 12-bed adolescent unit. We are expanding. We are gaining 10 more beds, 6 more child and adolescent beds, and 4 more adult beds in the fall time. We're under construction right now to expand those services. We do also have a partial hospitalization program in which patients can come and do group therapy for 5 to 6 hours during the day, and it runs about a 10-week program. We are kind of restrained right now to only having 7 participants at this time, but due to COVID, when the social distancing factors are lifted, then we can expand our programs. We do have that for adolescents, and we do have that for adults. Our adolescent program is currently not functional because of COVID, but we are looking to reopen that in the fall as well. Within our system, we have the ability to complete crisis intervention and crisis assessments through the emergency room. We have a very robust assessment and referral team that works with patients. We can provide resources. We can also help with disposition to get, if we are not able to provide a resource, we can help you get to those resources. We also, pairing up with our assessment referral team, we have it's called the Solaris team, and they are able to provide substance abuse resources. And we do a warm handoff for patients from our emergency room to treatment centers. And then we will help follow the patient for 12 months after that to help with any addiction issues as well. So we that is a program that I don't know that a lot of people are aware of, that we offer that. And then we are currently working with the fire department, and it's a mobile integrated health program. And within the fire department, we have a nurse from the Center for Mental Health that goes out, and we try to bridge the gap between inpatient services and outpatient services. We work with those patients, try to assist them if they have any medication questions, if they have any questions about what's happening, trying to prevent crises before they happen. And that is a newer program. It's under a pilot stage right now with us. But Swedish American, our mission is dedicated to the community and serving the community. And we are lucky to have these services and to be able to provide inpatient mental health services in Rockford. So thank you, Danielle, for having us.
Thank you. Let's see who wants to go next. How about Live Real Foundation? Where'd you go? There you are.
Hello. Yeah, my name is Bev Pommering, and I am the founder of Live Real. And I've struggled with anxiety and depression for most of my life. Unfortunately, it took the majority of my life for me to discover that I wasn't alone, and that is why I'm here today. Share with others on this matter. And part of my story starts in 2010 when I lost my mom in a tragic lawnmower accident. And it was just 6 months after I had found out that the man who sexually abused me as a child was arrested for abusing his own granddaughters. So those two events, traumatic events, sent me into a 3-year battle of deep depression, anxiety, debilitating panic attacks. And I do believe that it was to help me in that those years to prepare me for the darkest time of my life. And that time I'm referring to is the summer of 2019. In June, I watched my dad die from a long battle of dementia and lung cancer. In July, I found myself watching my brother in the ICU, narrowly escaping death from a subdural hematoma. Then in August, the 27th, I woke up in the middle of the night to a knock on the door from the Boone County Sheriff's Department. They told me that my 20-year-old son was in the hospital due to a heroin overdose. I lost my breath. I stood there in disbelief, asking how could this happen to me? My husband, my 18-year-old son, and I rushed to the hospital that night, only to be told that our son would not survive. They were keeping him alive on machines just so we could say goodbye. With that, I don't understand it, but somehow God took my pain and turned it into something manageable. He has given me the passion to live my life, not only for him, but to share it with others. And that is why I founded Live Real Charity Foundation. We raise funds to bring education, awareness, advocacy for mental health and drug use and how they're connected. Live Real is an acronym. It stands for Living Life Relational, Empathetic, Authentic, and Loving. This is how my son lived, and this is how we at Live Real believe we can end the stigma of mental illness and drug use. Currently, we're partnered with Winnebago County Health Department to offer free Narcan training. We are working on an awareness education program to bring to local school districts. And in the breakout session, I can spend more time speaking of my journey to Live Real and what we offer. So I appreciate it, Danielle. Thank you very much.
Thank you so much for sharing, Bev.
Yes.
We appreciate it. Very brave. How about Veterans Path to Hope? I'm sorry, are you eating? I don't mean to interrupt.
No, not at
Okay.
all. No, I'm fine. Thank you, Danielle. Yes, thank you. Yes, it's definitely an honor to be here. My name is Sean Merchant. I'm with Veterans Path to Hope. We're located out of Crystal Lake, Illinois in McHenry County. Actually, we've been in the Rockford area, oh gosh, probably about 4 years now, largely by a couple of our grants, one of them being the housing grant for housing homeless veterans and their families. And then here recently, past 3 years, through Legacy Corps, through home health care aids, through having the presence out there through a local office. But let me go back a little bit on what we are and what we do as an agency. The Veterans Path to Hope, formerly known as TLS Veterans. A little back story on that. Maybe in the breakout rooms, I can kind of go a little bit more in detail about that. But Veterans Path to Hope is basically an agency that helps out veterans and their families with a hand up. We have a wealth of services of one of them being our flagship to our agency has been a transitional living facility in Hebron, Illinois. It's called New Horizons. It's a retrofitted hotel that has 20 beds or so for veterans and that single veterans that are wanting to take some time to transition, either recovering from substance abuse issues, mental health issues as well. We have clinicians on board at those facilities as well. The grant that I work for, me being a case manager and 2 others, we assist in basic case management assistance for housing veterans with first month's rent, security deposit, the financial aspect of things, were appropriate referral assistance, and having a wide array of landlord contacts to get veterans moved into their own place. To branch off of that, how do you build up a veteran in their household? We do have another program in our agency that we have a warehouse of used furniture items as well, pots, pans, dishes, things to set up a veteran and their family into their own place. We also have a drop-in center where there's direct peer support. We have a food pantry assistance as well. Lining out all this is the outdoors program too, that we have where veterans can go on fishing trips with other veterans and just make connections that way. Now, out of the mental health aspect of our agency, we do have actual licensed clinical social workers that are on board in our agency that do individual group sessions, and then they also have actual group sessions for the Vietnam War era veterans, and also have the Afghanistan, Iraq, post 9/11 veterans meeting for groups as well. So there's all kinds of things that we do here at Veterans Path to Hope, and I look forward to addressing any questions and concerns about what we do, and we appreciate this opportunity. Thank you, Daniel.
Thanks, Sean. We appreciate you coming. Nice to see you in not real life, but kind of. How about Rosecrans?
Thanks, Danielle. Hi, everyone. I'm Joan Lodge from Rosecrans. I'm the administrator of our adult community mental health programs and also a NAMI board member. So I'm privileged to be here today, and thank you for extending the invitation, NAMI. So Rosecrans is a private nonprofit behavioral health organization with more than 60 sites in Illinois, Iowa, and Wisconsin. Rosecrans is a comprehensive behavioral health network serving more than 40,000 families annually. Rosecrans offers addiction services for adolescents and adults, including prevention, intervention, detox, inpatient, and outpatient treatment. Also has a big focus on family education and family treatment while a loved one is in treatment. Rosecrans offers outpatient mental health services for individuals pretty much of all ages, anywhere from very young to 3-year-olds, 4-year-olds up into the geriatric population. We do this through screening, assessment, therapeutic mentoring, school-based services, telehealth services, community-based treatment, psychiatry, and crisis intervention. The way that we really determine what is in the best care for a person is where it starts by the first contact of actually doing a very comprehensive assessment. So this assessment process is key to ensuring that we match the individual's clinical needs with the most appropriate level of care. Our residential stays typically last about a month, while our outpatient services vary really depending on the level of the client needs. In our Rockford region, our network of facilities offers extensive services of individuals for all ages. It aims to meet the specific need of each individual by creating a highly individualized treatment plan and provide services along the continuum of care of wherever that client might be in their journey of recovery. And this extensive network is locally in Rockford, is at the Ware Center where I'm located at North Main Street. We also have a crisis response facility at our Rosecrans Mulberry location, where this really offers drop-in, walk-in for the police department and for families who have concerns about a loved one or experiencing a psychiatric crisis. We also at that location offer crisis residential, which is a nice option and alternative to an inpatient psychiatric stay. We have 16 beds at this location. It's a nice opportunity when clients really need some more adjustments, perhaps to their medications. It's a voluntary program, so clients are really wanting to work harder and longer at their recovery. Could potentially be an option when someone is being released as a step down for an inpatient stay as well. We pride ourselves with those strong community connections with schools, local police, fire, and emergency departments, and other healthcare providers. Many of you I know were also part of this NAMI presentation today. We work well with. I think one of the things that make us very unique is that we provide treatment and supports for almost anyone with a mental health need and substance abuse need. We work closely with other agencies like I talked about, so individuals can find the care they deserve. Our services help people's immediate needs with the goal of providing lasting, changing recovery. We often strive to provide the voice to the most vulnerable because sometimes they really just don't have a voice to be heard. So we need to be that advocate and that voice. Danielle, if I can just share that I brought another guest from Rosecrans with me today as well, Danita Lind. She's our administrator for our Rosecrans Griffin Williamson location that has substance abuse services and mental health services for our younger population. So I wanted her to opportunity to share some stuff too. So thanks again.
Well, good afternoon, everyone. I have to say, I don't know how to top that, Joan. You did an awesome job describing all of our services and literally hit every bullet point that I wrote down for today. Just to add that, we really pride ourselves on really meeting the needs of those in the community. And we don't turn anybody away on inability to pay. We have so many different funding sources for people, even if they don't have insurance coverage. And really work well to meet everybody's needs. So, but I think Joan did an excellent job just really describing all of our services from youth all the way up through, as she said, those in adult ages.
Thank you both for coming. I appreciate it a lot. How about Crusader?
Can you hear me okay?
This. Yes, I can. I'm doing this in no order.
Okay.
I'm just choosing randomly.
So I'm Christina Geiselhart. I work at Crusader Community Health as a behavioral health provider. And Crusader is typically known for healthcare in our community. However, over the past several years, we have really built a very robust behavioral health program. And we have at least one of our behavioral health providers at every site now. And some of the sites even have two. And we also have a pediatric care manager who helps out in our pediatric unit, coordinating care for some of those kiddos with the school, with their IEPs, if they were in SAS, making sure with Rosecrans, we do a lot of coordination with some of the community members, which is great to have those partnerships. And so in addition to that, the behavioral health team, what we really do is a fully integrated model. So we are on the units with the medical providers. We can have warm handoffs in real time with the providers if they have a new client that has some mental health needs, stress, anxiety, housing issues, trouble coping with a new diagnosis. We work a lot with patients who are struggling to follow their, their care plan for their diabetes or other health issues that they have. And so sometimes we'll be brought in for things that aren't typically thought of as mental health related, but we definitely have a big impact on helping those patients adjust some lifestyle behaviors, but also giving them a lot of support in those moments. We have a women's health unit as well. So we work with women during their pregnancy, after pregnancy. We also work a lot with grief and loss within that unit. And so making sure that everyone gets connected to community resources that are appropriate. If they are not able to connect with community resources outside of Crusader, we also offer ongoing counseling sessions for those individuals. So whether it's a language barrier and maybe they can't access services elsewhere because they don't offer language services, Crusader offers language services. And so we're able to do that and help those families out. Insurance is another concern for a lot of people. And Crusader is a non-for-profit and we are a federally qualified healthcare center. So we get a lot of funding and support for patients who have no insurance and have no way of paying for their healthcare otherwise. And so that also goes along with their behavioral health services that we're able to offer those discounts for them. One of the things that is really unique about Crusader is that we really try to meet the needs of our clients. And so as we learn about new barriers or issues that are coming up in the community that we keep hearing about, there's some consistent issue where something is missing, we try to find a way to build that into our program. One of those is what we're really proud of, we just launched, is our substance use program. So now we also have a fully integrated substance use disorder treatment service where we can also offer Suboxone and we can manage those patients with their primary care providers. So they don't have to jump through all these hoops and go through IOP or groups or anything like that. We can do things for more individualized for some people. And we also have evening hours and some Saturday hours. So we really are trying to meet the needs of some clients in the community that feel like other services maybe aren't accessible due to their work or what other issues they have. One of the things that is, I think another thing that's really important to understand is that we are not a replacement for some of the more intensive mental health outpatient services. Our services are to help fill some of those gaps. So we definitely still refer to some of those places that offer groups for people who that is appropriate for, or who need a psychiatrist because that's appropriate for them. We have a lot of hospital discharges. Some of those people just need someone to follow them for their medications, but some of them do need to be connected to those safety nets within the community. So I think that Crusader does a really great job trying to build those partnerships and, like all of you, trying to help serve our community. So thank you.
Thank you very much. How about ramp?
Hello. So, my name is Ron Jackson, and I'm here representing RAMP, which is a center for independent living in Rockford, serving individuals with disabilities of all types and all ages. We have a variety of programs from housing modifications, home services, employment, um, school, help with school, IEPs, things of that nature. So we can pretty much help with anything that someone might need. And if you come to the breakout room, we can tell you more. Thank you.
Thank you, Ron. How about Marshmallows Hope?
Hi, can you hear me okay? All right, I'm Laura Kane. I am the Executive Director of Marshmallows Hope nonprofit organization. I started the nonprofit organization in honor of my 14-year-old son, Zachary Burkholz, who died by suicide in 2018. And our primary focus are the youth in our community, kids 9 to 19, who are living with depression, anxiety, suicidal ideations, or victims of abuse. Our organization is here to raise awareness and help break the stigma that surrounds mental illness, as well as advocate for the youth in our community who feel that they have to suffer in silence, just like my son did. We have developed a one-on-one mentoring program called the Hero Program, where we help, encourage, reach, and overcome. Basically, we pair the youth in our community with volunteer mentors, and we teach them that they're created for a purpose and on purpose, but more importantly that we advocate for their mental health. We prioritize or teach them to prioritize mental health. We're not professionals, professional counselors. However, we do have a great team that backs us of licensed clinical social workers and counselors that actually do offer those services to the youth in our community. We certainly, with Marshmallows Hope, understand that living with a mental illness has a stigma that surrounds it, and we advocate to help break that stigma so that we can get these kids to realize that it's okay to not be okay, and that reaching out for help is the way to go. That it doesn't make them any less of a person for reaching out. I'd love to talk to you guys more about our organization in the breakout room. So if you have any more questions, please, I'll see you in the breakout. Thanks, Danielle.
Thank you, Laura. How about Children's Home and Aid?
Hi, good evening. I'm Lori Poppin. I am the Director of Behavioral Health at Children's Home and Aid in our northern region, which is located in Rockford. We have a lot of different kinds of programming, several that are not necessarily mental health related, but that may have different mental health components. So one of the programs that we currently have that's pretty small right now, but we are expanding, is called the EPIC program. And it originated as a prevention and early intervention program back in the mid-'80s, but it transformed over the years, mostly due to funding, into a mental health program for children and adolescents. So in that program, we provide counseling for kids and families. We will currently, in our expansion, be focusing a lot in the Harlem School District, although we will be able to take referrals outside of that area as well. We will do counseling. We will help parents with behavior management. We'll do some advocacy and case management and work with the schools to try to help identify the best learning environment for children. We also have a program called Adoption Support and Preservation. It's ASAP for short. And that program works with families who have adopted or who have subsidized guardianship. And in that program, the therapists focus on primarily attachment issues, and they work with the entire family. A lot of those services happen pre-COVID. Those services often happened in the home. A lot of what we've been doing in all of our behavioral health programs has been virtual, but we are hoping and starting to slowly move toward more in-person services. So in that program, it is also therapeutic. So there's counseling, therapy, some case management, referrals, and advocacy that happens in that program as well. And then the other program that I wanted to mention is our Mother House Crisis Nursery. Although it's not a mental health program, they do provide crisis care for children ages 0 up through the age of 7. And that program can be used by families who might be experiencing a mental health issue. So a parent could use the crisis nursery for a stress break if they were, experiencing a lot of stress at that time, that would be a reason that could be considered a crisis. Also for medical appointments, those kinds of things. There is an intake process that happens in order to use the crisis nursery, but I think that it fits well with some of our other mental health services that we provide, especially for families and parents. So also I'd like to have Celinda Smith talk a little bit about our SAFE program through Children's Home and Aid.
Hi, yep, I'm Celinda Smith. I'm the therapist for the SAFE program. It's Services and Advocacy for Empowerment. It's a free program that we provide. It's grant funded to children and families to help them heal from exposure of multiple forms of victimization. So the eligible participants are children 18 years old and under, as well as their caregivers that are 18 years, that have children in the program that are 18 years old and under, who have experienced multiple forms of violence or victimizations and are also residents of Winnebago County. So those are the two eligibility requirements for the program. Our services include counseling, therapeutic counseling, case management, referrals, linkage, advocacy, and parents and participants, we can provide them with information about exposure to violence, trauma. I'm specifically trained in evidence-based interventions like EMDR, play therapy. So those are just kind of the interventions that we use with the children and families. And then we also have a new grant that for our new program that will be primarily housed out of the Family Peace Center. That's very similar to the SAFE program here that will hopefully be up and running soon. But that would be specifically to work with children and families that have experienced some sort of victimization related to domestic violence. So yeah, Lori and I can answer any questions in the breakout rooms, but thank you for having us.
Thank you both. That sounds like a good segue. How about you guys, Family Peace Center?
All right, I will keep my end of things short. Sierra Kellen is also on. I'm Annie Hobson. I am the Youth Services Manager at the Family Peace Center. And just as the title, everything I do is related to youth and helping those youth restore from the trauma that they've been exposed to in a DV home or even sexual abuse. I think Laura Kane said it best, helping students and youth understand that they don't have to do this alone is vital. It is a key piece to the work that I do. There are 4 specific programs that I help to implement, which are prevention and intervention based. And in the breakout room, I will talk a little bit more about that, as many of the partners on here we work with and are very aware of what we do. So if you guys come into the breakout room, we will talk a little bit more about youth programming and how we utilize those programs to help our babies heal from the trauma that they've been exposed to through domestic violence.
Awesome, Annie. Well, my name is Sierra Kellen. I serve as the operations manager and get the privilege of working closely with Annie and many other staff at the center, including about 25 different partner agencies. So The Family Peace Center really exists to be that central point of contact for survivors and their families experiencing 5 different victimization types, which include domestic violence, sexual violence and abuse, child abuse, elder abuse, and trafficking. So if a survivor has experienced in their lifetime any of those victimizations, they're eligible for services at the Family Peace Center. We keep it really simple. The referral process is simply calling our phone number, whether you're a professional working with someone and you want to make that referral. Again, we'll provide this information in the breakout, but it's just 779-348-7600. You can find us on Google, Facebook, Instagram. Our contact information is readily available. And currently we're in operation Monday through Friday, 8 to 5. We made that decision because we opened in the middle of the pandemic and we were serving almost everyone virtually at that time. As people are becoming vaccinated and becoming a little more comfortable being in person, we're starting to be very busy at the center and we are walk-in. So you could send someone our way and they don't need to call ahead, although they can. And it certainly allows us to just make sure we've got, plenty of socially distanced space. But if someone's in crisis, they're welcome to come down anytime in that time frame. And as I mentioned, we work with about 25 partner agencies. So the Family Peace Center as an agency is not the expert on every part of that dynamic of those 5 victimization areas. We rely on the expertise of many organizations who've been in the community for decades and do their job extraordinarily well. We just meet with the survivor, understand their needs, and then offer a menu of services based on what each of our partner agencies provide. And then we have a conversation with the survivor about each of the agencies and how they might help meet their needs, what their confidentiality might look like, what is sharing information look like in that context, and then help the survivor make an informed choice about what she or he may find to be most appropriate for them at that time. And then we make that warm handoff to the agency. We have several agencies on site, more are coming on site as more people are getting vaccinated. And then we have many other referral partners that we can make a phone connection, help schedule an appointment, or have the agency bring somebody down on an on-call basis based on the agency. So we try to be as comprehensive as possible to take the stress away from the survivor of trying to navigate the system, because we know the partners and the players in our community. And so we're able to make those connections that are appropriate for that family and hopefully reduce stress in that way. And then we walk with them long-term. So we say we don't close out a case after 3 months. That person is a client with the Family Peace Center as long as they'd like to be. And so that includes support group services that we're getting started. That might include just coming to the center if they need a calm space to maybe check their email in a safe place. We do have childcare on site while the family's on site. So we're not a DCFS licensed childcare facility at this time, but we do watch kiddos so, parents can take care of adult business without little ears in the room. And everything we do is informed by the survivor. So we have a Survivor Voices Committee that informs all of our work. They look at everything from our logo to how the space feels when you walk in, to just make sure that it's all informed by people with lived experience. So we're happy to talk with you more in the breakout rooms. And thank you again to NAMI for putting this on.
Appreciate you both. Thank you. How about Rockford Sexual Assault Counseling?
Well, sure. Hi, everyone. Hope you're having a happy Monday. I'm like gathering in all of this information. I do have to say, though, and admit to you that waiting for my name to be called was kind of giving me like the same feelings of being in gym class. Like somebody's about to call on you and you're like, I'm ready, but I just don't know when, right? So that's where I'm at right now. But like I said, my name is Sam. I'm from Rockford Sexual Assault Counseling. We provide free and confidential counseling services to survivors of sexual assault and sexual abuse and their family members. It doesn't matter if the abuse happened 5 years ago or 5 minutes ago, you qualify for our services. If you love somebody, care about somebody, live in the same household with somebody who has suffered this kind of violence, it's really, really hard to be a support person, right? The strong friends are always the people who struggle the most, so you qualify for our services as well. All of our services are 24 hours, so we have a 24-hour crisis hotline that you can can call. Primarily, we use that line for issues related to sexual violence, but if you ever have anything going on that doesn't have to do with one of those topics, you're just not quite sure where to go or who to reach out to, we'll never not answer the phone on you, right? That's a part of having 24-hour services. So we'll get you pointed in the right direction. A part of those 24-hour services, besides just the crisis hotline, we also do medical advocacy. So if anybody presents to a hospital room after an assault, we will send an advocate to the hospital to sit with them, support with them, and just kind of be there. I always say when I walk into a hospital room that I am there for that person, even if that means that they want me to leave, right? I'm there to support you, answer questions. You're in that moment going to get a million things thrown at you. And sometimes it's really nice just to have somebody who kind of knows what's going on, be able to prepare you for what's next. Other things we do at our agency, we have a legal advocate at our agency that can help with things like orders of protection. And if any cases go to court, we will send an advocate to sit with you during the court processes. And then that brings us to my not biased at all favorite part of the job, which is prevention education. So I have the opportunity to be a part of an amazing prevention team where we go around in our community, primarily in middle school, high school, and elementary schools. And we talk about topics like sexual violence, dating violence, bullying, self-esteem, harassment. This year, we have been adding in internet safety and sexting, which I have to say is very fun to talk about with high school students because they have more information than I do about all of that. So yeah. The purpose and the primary goal of our prevention services and really our services as an agency is to let survivors of sexual violence know that they're not alone, right? That's the theme of our night, letting people know that whatever you're walking through, no matter how hard, no matter how unusual, no matter how heavy, it's not by yourself. You have a lot of people around you who love you, care about you, support you, want to keep you safe, even if they're strangers, right? Even if you have never seen a person across a screen before, you've talked to them, now you know that we're out here. To summarize our services, I had a high school student today actually say something so beautiful, and I was like, I'm stealing that. And then of course they're in high school, so they're like, yes, use that. But he said that we are primarily all good people who want to do good people things. But good people can be just as bad as the bad people if they're quiet about the bad people things. And I think that that's really who we are as an agency, is we're just trying to be good people, doing good people things, talking about the bad people doing bad people things, because it's natural to not want to talk about things that make us feel nervous, uncomfortable, or weird, right? But pretending that sexual violence doesn't happen, pretending that mental illness doesn't have an effect on our community, it doesn't stop the problem. It doesn't help anybody. It just isolates people and make people even feel more alone. So I appreciate all of your time today, and I'm looking forward to meeting with anyone who wants to come to the breakout room. I feel like I'm like selling myself, like, come to the breakout room. Thank you.
Thank you, Sam. I'm sorry that I made you nervous waiting for me to call on you. How about OSF Thrive Trauma Recovery Center?
Hi, it's going to be hard to follow that up. Sam did a really awesome job on describing, I think, how most of us feel waiting to be called, and just a great presentation by so many people. My name is Brandy Beck, and I'm a case manager at OSF's new Strive Trauma Recovery Center. And this is my coworker and office mate, Kira McConaughey. She is also our outreach coordinator. So we are part of a small team of 9 peers, which consists of 2 case managers, 3 therapists, 1 outreach coordinator, 1 clinical supervisor who also provides therapy to clients, and 1 manager. A little bit about our program. The Trauma Recovery Center, or what we refer to it as the TRC, is grant funded through ICEJA. Our grant is good for 3 years, and we are in our 1st year. Basically, we really got the last of our team member in January. So we're really just trying to like get off the ground right now. We're at the very beginning stages of our program. We work with victims and also family members or witnesses of violent crimes, ages 14 and up. Some examples of the type of crime survivors we work with include, but are not limited to, sexual assault and abuse, domestic violence, trafficking, mass shootings, and gang violence. We provide therapy with licensed clinical social workers who are all certified in trauma therapy. We also provide case management, advocacy, and intensive outreach for those who may be on the wait list or may have trouble really committing to the program. In the future, we will also be doing groups in the evenings. These groups will be based on the needs of our clients and may include a seeking safety group, which addresses trauma and substance abuse, a group on grief or domestic violence. Our main goal is really just to try to help our clients remove all the barriers by providing services to clients in the community versus an office setting, so that they can really just focus on the trauma instead of adding more barriers and like, oh, you have to come to our office to see us during these hours, but you don't have transportation and maybe you need to work, you know. So we really recognize that for our clients. All of our services are free to individuals who reside in Winnebago County. Patients can be referred from another agency, an OSF provider, or they may self-refer. They can contact the office directly Monday through Friday. I'm going to give our number and I'll also give our email during the breakout room. But really quickly, the main phone number for the TRC is 815-227-2688. And then if being referred by an agency, there's also a referral form that they can complete, and that can be sent over via fax or email. And then our email address is trcreferral, REFERRAL, @osfhealthcare.org. And that's it. We would love to have you join us in the breakout room if you have any questions or you would like more information on our program. Again, thank you for having us, Danielle. Everything's been great.
Thank you, guys. Charmaine, I think I saw you on here for Shelter Care Ministries. I'm not sure if you're the phone number. All right, maybe we'll wait a sec. How about Youth Services Network?
Hi, I'm Becky Kilo. I am the program supervisor for two of our counseling programs. The first one is our gift counseling program. That one, we service children, adults, families that have been involved or that are involved with the child welfare system. Primarily, our referrals are coming from DCFS or other child welfare agencies. However, we do accept community referrals based on insurance. We don't charge anybody, but we will bill an insurance company. Our services are community-based, so we meet with our clients in their homes, in the park, at a library, if whatever makes our families and our kiddos comfortable. I'm trying to think what else we do. We do family counseling, we do couples counseling in this program. All sorts of parent coaching kind of things, lots of different counseling. All of our services are trauma informed. We do a lot of sand tray therapy, play therapy. Right now, the majority of our services are back to being in person. We do still have a couple that are virtual based on clients' desires or wants. The other program that I supervise is we have a counselor and a case manager as part of the Family Peace Center. We provide services through the Illinois HEALS grant to children or adolescents between the ages of 0 to 25 that have been victims of or survivors of domestic violence, physical, sexual abuse, sexual victimization, trafficking, or child abuse. So we are working closely with the Peace Center on that. And I'm going to turn it over to Lindsay Blackwell to talk about the rest of our programs.
Okay. I'm Lindsay Blackwell. I am the supervisor of our IPS program that stands for Intensive Placement Stabilization. It is specifically for kids that are in foster care. The overall objective of the program is to make sure that kids are not bouncing from foster home to foster home. So we do a wraparound approach where we provide intensive services. We offer a counselor, a case manager. The case management can look like mentors, so like big brother, big sister services, also can provide tutoring. And then that facilitation piece, we are strength-based and trauma-informed, and so we believe that we can build up the strengths of our youth, and use those strengths for any buildup of support for areas that may be of a concern. We also do have a social emotional therapist through the city of Rockford at the Head Start and Early Head Start program. So we also are able to provide counseling services on site and in the community for youth that are enrolled through those programs. And then we also have contracted through Rockford Public School District, where we have our trauma therapists. They are also on site at select schools. And we can share more information about that in the breakout room as far as if there's curiosity of what schools. Yeah, we have a lot of different counseling programs, but those are the main ones.
Thank you. Stepping Stones of Rockford. Chris, I see you somewhere. Like you've been hiding from me though.
I'm here. I'm there. Now you can actually see me. Hi, everybody. I'm Chris Overton. I'm the Director of Services at Stepping Stones. We are physically located in Rockford. So our primary service area, is Winnebago County. Our program serves adults over the age of 18, and they're all individuals that have a severe and persistent mental illness. We do have, in terms of, we're kind of known for residential type services. We have a lot of different programs and different levels of care. So the group homes, we have 5 of them. Again, all serving adults, males and females. And typically that's kind of the entry point for people who require a high intensity of services. So people who are having acute symptoms of their mental illness and perhaps have not been successfully treated in other environments, with less intensive services. The goal is for those individuals to progress to more stability and more independent functioning so that they don't have to stay in a group home forever. So ideally then they're going to transition to a supervised apartment where they'll have staff still 24 hours a day that can start to do some things for themselves that, so strengths based, if I'm good at doing my laundry, no one needs to help me with doing my laundry and so on. Gradually then they're progressing to living in the community. Where they only see staff, once or twice a week, and are functioning, working, having relationships, all those great things that the rest of us value. But we've noticed that there's such a high demand for those programs that a lot of people can't wait as long as they need to wait to get into those programs. So we've started to bring people in more directly through our outpatient services program. So a lot of times these folks will either continue living with a family member, or maybe they have an apartment of their own in the community where we can wrap more intensive services around them, where they're seen, multiple times during the course of the week. They can get counseling with us, case management, and they can see our psychiatrist really frequently. And I think that that's one of the bonus things. I hear locally it's hard to get in to see psychiatrists, in all kinds of arenas. Our clients, from the point that they come into our program, they can see the psychiatrist within no longer than 2 weeks from the point of admission. And I think y'all, who access mental health care for your people know that that is a pretty rare thing. So anyway, we have the outpatient services in addition to the residential. We have a program that specializes in working with adults over the age of 50. I used to think that was old, except for, dang it, now I'm 50. So these are my peers, but they live in a building that have staff there during the day. And they tend to have more complex medical, although not to the acuity of a nursing home. So there's some more specialty services that go for that. Some of the additional things that we do, we have a contract with DCFS to serve their 18 to 21-year-old youth. We do outpatient fitness restoration for Winnebago County. We have a contract with the state of Illinois to treat individuals that have been granted conditional release. These are mostly people who've been found not guilty by reason of insanity, but over time in a inpatient setting have stabilized and earned the ability to come out and reside in the community. Let's see, what else can I tell you? One of the things that my CEO wanted to make sure that I share is that we were fortunate enough to get grant dollars from our local tax dollars that went to developing mental health services in Winnebago County. So we will begin the process of opening an outpatient counseling center. This would be for all individuals on Medicaid, and it would not only serve adults, it would also serve youth. So we've identified that seems to be a pretty significant deficit in our community, at least the timeliness of access, and then again, that access to psychiatric services. So this would be set in Rockford, and it would have on-site therapy. The people would have access to psychiatric services and case management if desired. So that will be coming down the line. It will take us some time to get that up and running, so don't call me tomorrow about it. Our services as a whole are primarily for people who are on Medicaid. So these are individuals who have low income typically. Although if our people do live in one of our residential facilities, they do have to have income, some means to be able to pay, room and board kind of a thing. Although if they live with family, then, whatever their deal is what their deal is. Let's see, we do currently have a waiting list for all of our residential programs. I know people get excited about that idea and then, call and then they want to get in tomorrow. Obviously there's way more demand than what is available in terms of housing availability. So you can make referrals and add people to the waiting list. And then, based on their demographic, when their name comes up, then they have the opportunity to interview and be considered for that program. I think that is about it. Thank you, everyone.
Thanks, Chris. Charmaine, did I see you pop on screen here?
Hello, Danielle.
Hi.
Can you hear me?
I can hear you.
Okay, I am on. I had to use my phone.
Oh, that's no problem at all. The
Sorry,
floor is yours.
I don't have much to say. I kind of popped in late. What we're doing at Jubilee right now, we're trying to increase our services gradually throughout the months of June and July. We anticipate by July that we will be at full capacity again, and it will steadily increase over the next few months up until the fall season. And by winter, we should be back to normal. This is what we anticipate. This is not what will actually happen, I'm sure, but we're hoping for the best.
And for those that don't know what the Jubilee Center is, you want to just give a little background?
Jubilee Center is a ministry of the Emmanuel Episcopal Church here in Rockford, Illinois, and we provide mental health services and support and advocacy to our community of mental health clients and those who are homeless, the homeless population. Our primary partner is Rosecrans Ware Center. Most of our referrals come through Rosecrans, but they can come from a number of entities as well. We just try to keep our people safe and supported as best we can on a daily basis. And they've been real troopers throughout this pandemic. Those who have been faithful followers, we're very grateful for them. They've come by every day since the pandemic began, even if it was just for a sack lunch at the door or if they come in for coffee. So we're grateful to our people that we serve.
And we're grateful for you guys.
Thank you.
Thank you, everybody. I think that wraps up the introductions. So how many of you have done breakout rooms before? We're all going to learn together right now. Well, I have not run one before. So I'm going to open them. And if you see your room on the bottom of the screen, do you see where it says breakout rooms? You can choose your room and just join. And you can leave the room and join another room whenever you want to, I think. And if you need help, I will definitely help move you into a room.